Several important changes to HSA rules are going to take effect beginning in 2026. So most people have no idea that they just gained access to one of the biggest tax breaks in the US. So for the first time, bronze and catastrophic marketplace plans are going to be HSA compatible, and even direct primary care memberships can be paid tax-free. So why this matters, millions who were previously locked out can now save thousands in pre-tax healthcare dollars. So if you ignore it, you could keep paying for expenses with post-tax money, while others may be using their health savings accounts because the plans that they have are now HSA compatible. So it's a financial advantage for anyone, and you can certainly take advantage of this during the upcoming open enrollment here as we get ready for the 2026 open enrollment. So what an HSA compatible plan typically was in the past, you had to have a plan that met what's called a high deductible health plan. So it had to have that designation. So there was a deductible limit. In the past it was, well, let's just use 1700 as an example. It had to be at least 1700. Many of the HSA compatible plans, this year and in prior years had a much higher deductible than that. But you had to pay towards a deductible for all eligible health related expenses covered by the plan except preventative care. Okay, so that's how it is now and how it was in prior years. So every dollar you spend, if it's not preventive services, would have had to count towards your deductible. So any plans that had first dollar coverage, like a copay at the doctor, right? Or a copay for a prescription, those plans were not HSA compatible. So that's a big change going into 2026. So bronze plans, so these are plans that typically have an actuarial value of 60%, 60 to 70%, meaning like typically that's what you pay for covered services. Now you can have a copay. So you can have a copay at the doctor of 25 bucks, 50 bucks, and that plan can still be HSA compatible. It's an HSA qualified plan. So that's a big change because now you're just paying a copay at the doctor, uh, whether it's $25, $50, whatever the plan has, versus going to the doctor, not paying at the time of service, then getting a bill for the contracted rate down the road. So going forward in 2026, those HSA compatible plans, there's contribution limits like there's always been for health savings accounts. So it's 4,400 for an individual in 2026. For a family, it's going to be 8,750. And like in past years, if you're 55 and older, you have this catch-up contribution. So the catch-up contribution is extra $1,000, right? If you're 55 or older for a single, and then double that for a family. So if you're somebody that's 56, you can put away $5,400 into a health savings account. Obviously, if you don't use those funds for healthcare related services, they roll over year to year. You can certainly tie that HSA account to a money market account as well. So there's a lot of things that you could do with it, especially if your income is higher, where you're putting in money into a health savings account. You could be saving 25 to 30% in taxes. So you can kind of do the math versus what your expected out-of-pocket expenses are, and you can kind of line that up with the plan's deductible for those plans that are available in your service area. So this is a big change. The other thing that they made permanent was telemedicine. HSA compatible plans having telemedicine, meaning you can use like a 1-800 teledoc service where you call in the doctor and you're just paying a copay or no copay for those services. That's been made permanent. A lot of these like direct primary care membership programs like MD VIP, those sort of things can now be paid with HSA dollars. So that's another change that's made permanent. So as you're reviewing your options as coming open enrollment, this is a big advantage, especially if you're in that higher income bracket where you still can justify putting those HSA dollars away and having a copay at the doctor, copay for prescriptions. So this is a great option going forward. So for more updates, videos like this on coming changes with healthcare, you can also click on this one up here that we have for you. You can subscribe and continue to watch the channel. We'll see you guys soon.